So there's this assumption that pelvic floor PTs, or PT in general, like we don't support surgery, like conservative treatment's always the answer, which isn't true. I read a really interesting post in a running group the other day. This mom said, I'm really young, late 30s, and I'm having these issues. I saw a pelvic floor PT, totally running informed. We work on a lot of stuff, tried a pessary, and it's not doing it. And I'm considering this surgery. Has anybody had this surgery before? And I think that's such a great question. Whenever I have somebody that I'm working with that it's their first time seeing PT, or maybe they went to very, very basic PT, I think it's always worth a second opinion. But the thing I like about that, though, is it gives us an opportunity to talk about expectations. And if the expectations is high activity and it's a good fit with surgery, then I can recommend my favorite surgeons that I've worked with for years. I have a couple urogynecologists locally that I've worked with for a really long time. They're wonderful having discussions about things, and they're great surgeons. But yeah, there's certain circumstances that really just warrant that with leakage. PT can't fix fascial damage. PT can't fix avulsion. There's a lot of things that PT can't do, but when you check off those conservative treatment options and the symptoms still aren't where you want them to be, yeah, it's totally a good option. Many types of, come on, Abby, there's dogs coming. Many types of rectoseal, some of the higher rectoseals, they're gonna need surgical intervention. There's not really much that we can do as PTs or even with pessaries that can make that difference. But again, and I don't know that there's any studies to look at this, because I don't know if any studies looked at the role preventatively of pre-op PT and then post-op PT. I don't know that we even have any post-op. The more information you have, the more opportunities to kind of understand what's going on. And if you've done that pre-op conservative treatment, I think it just makes it much easier to have that conversation of, yeah, you know what, I've done all the things. It's totally appropriate for me to consider surgery. My PT thinks it's a great option. And we know exactly what we're going to do post-op so that we don't have an increased likelihood of revision or things like that. But I just thought it was a lovely question, and I was really, because usually those questions come out, I'm considering surgery. And of course our gut sense is, well, have you done PT first? But in this particular situation, she's like, yeah, I've done it. I've done all the things, and they were all really appropriate things. And yeah, I thought that recommendation was good. I'm like, just get somebody you trust, somebody that you like, somebody that you feel confident with. And the nice thing is you have that PT in your back pocket for the other side of it, and to get you back to running. Because I think that's where the question was. It's like, okay, if you've gone through this before, like how quickly were you able to get back and all that kind of stuff, which again, not great. You think there's no research on getting back to activity after pregnancy, postpartum. Yeah, after surgery, it's like, oh, it's all fixed. 6 weeks, you're done. Go back to do whatever. Like, it's the same thing, quite honestly. So I'd be curious if you have considered surgery before. Kind of, how did you sort of navigate that? What made you choose it? What made you not? Or if you're a pelvic floor PT and you're like, yeah, I work with pre-op, post-op. This is kind of typically how it comes to be, how I come to recommend surgery. How do you choose your favorite surgeons? Right? But yeah, let me know. I'd love to hear, because I think it's something we don't talk about enough, that there are certain circumstances that are totally surgical. And even patients that you think that maybe they could do better with PT, but just their lifestyle or schedule or things like that, it really just isn't going to accommodate it, and it really is impacting their quality of life. That may be the very best option for them. So let me know what you think. I'd love to hear from you. If we can figure out how to stop this, Abby, don't pee on everything.